their PET scan, their images, their pictures. So they actually can go home and read about what they have.
I mean, call me naive, but I would assume most practices would do this.
I can tell you
they don't.
99% of the patients that come have no paperwork. They've never seen the paperwork, and they don't know what's being said or written about them. Now, this man came, and the doctor, who's supposedly a robotic expert, wrote this about the patient. And I'm reading straight through what he wrote. The patient was most interested in learning about surgery for prostate cancer, in particular, robotic procedure. I explained to him the details of the operation and the anticipated post-operative course. Then I reviewed the potential short and long-term risks of surgery. These include, but are not limited to, infection, bleeding, positional injuries, deep venous thrombosis, pulmonary emboli, bowel injury, rectal injury, ureteral injury, cardiac or respiratory problems, penile shortening, urethral strictures, incontinence, infertility, impotence. Lastly, I explained that while I prefer a robotic approach, there is no convincing study demonstrating clear superiority over either open or conventional laparoscopic prostatectomy. This is the chief of robotic surgery at a big cancer hospital saying he advocates for robotic surgery, but there's no data to support it. Now, doctors are supposed to be scientists, and doctors are supposed to be able to analyze the data.
Sure.
And to make you think that they're advocating a procedure with all those potential risks and no data showing it's better makes you wonder what's going on.
Yeah.
And when they push this patient, 85 years old, to go through surgery, it makes you wonder what's going on. Maybe patients are waking up and understanding, maybe thanks to like this program, that there's better treatments out there than removing the prostate. Removing the prostate doesn't mean you're going to be cancer-free. It just gives you a list of complications. And just as a proof, let's say, that prostate removal doesn't cure the patient necessarily, here is on page 8 of our prostate booklet, which we'll mail at no charge, the rate of cancer-free survival. How many patients are cancer-free if they went to one of the biggest surgeons in New York versus if they went to us for our premium program of radiation seeds. Well, if you had a PSA 4 to 10 and you went to see this big surgeon, your chance 5 years later, after having the whole prostate removed, is only 76%.
Okay.
So it means a quarter of the patients have had recurrence of their cancer already.
Right. After 5 years.
At 5 years.
At 5 years, okay.
So you're not home free.
Sure.
A quarter of the patients have had recurrence. Now, if those same patients came to us, and we've treated thousands of patients, the chance of success for the PSA 4 to 10, instead of being 76%, is 90%, 18% higher. So again, if you go into Atlantic City and you're betting your house on it, do you want the 76% chance or the 90% chance?
90% all the way, Doc.
Okay, so removing the cancer by radical prostatectomy doesn't guarantee anything except a long list of complications. And if you look at the men who have, let's say, PSA 10 to 20, like this man, go to the chief at a big cancer hospital, the chance of being cancer-free after removing the prostate is 69%. With us, it's 86% or 25% higher. So there's better treatments out there than removing the prostate. Removing the prostate doesn't make sure you're going to be home free. It just gives you home a mess if you're incontinent with urine.
I think that's a huge misconception.
It's a huge misconception.
If the prostate's gone, the cancer must be gone.
It's not. It's just the opposite.
Yeah.
The prostate's gone, but they can leave the crumbs. Just like you cut a loaf of bread, what happens to those crumbs? Well, you cut the prostate out, what happens to those crumbs? Well, with cancer, those crumbs start growing.
Sure.
And that's why these men are having recurrences after they're being told they'd be home free. They're not home free. The only thing that's home free is a word from our sponsor, the man today who does not have the golden voice.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. And you're welcome to call us. We're sorry we lost a call, and we know that if you want to call us, you're welcome to do so. John, what's that number?
Yeah, 800-848-WABC. Again, 800-848-9222. And we are live at this hour. So we're happy to take the calls.
Yeah, it's so cold we should be in bed like everybody else. Well, we know a lot of people are out there driving listening to the radio. That's and wondering what's going on, and we're going to talk about other news. And I want to talk really for a few minutes about smoking and the politics of smoking and what smoking means, because often people see smokers, but we don't really necessarily understand what it means.
I think everybody thinks they know what it means.
Okay, and certain people are telling people don't smoke, and other people say, I know someone who smoked who was, 105.
Yeah, sure.
Okay, so I want to talk about an article that was in New England Journal of Medicine by a named Dr. Ha, who's a PhD, and he's analyzing data from St. Michael's Hospital in Toronto. And he says, on the basis of current smoking, about 50% of young men and 10% of young women in most countries will become smokers, and relatively few stop. With that, the annual tobacco death rate, which is right now 5 million people die a year from smoking, okay? It's going to rise to 10 million people dying a year from smoking as these young smokers of today reach middle and older age. It's due to population growth, and in some cases, former smokers, like people that smoked 100 years ago or 50 years ago, smoked very little, maybe 1 cigarette a day or 5 cigarettes a day. Now people are smoking more.
Sure.
And in many societies, the cost of smoking is actually pretty low. So I know here in New York City, a pack is about, $15?
Yeah, very, very expensive, yeah.
And there's a reason for that, which we're going to talk about. So if the current smoking patterns consistently maintain themselves, smoking will kill 1 billion people in this century. 1 billion people.
Unbelievable.
Can you believe that?
No.
And it's going to be mostly in low and middle income countries. And half of the deaths occur before the age of 70. So when it occurs before the age of 70, obviously it takes away a lot of your good years.
Sure.
We know every year is a good year,
yeah.
but when you die of 30 and 40, it's quite something. Now, one of the main determinants of deterrence of smoking is price. Worldwide, if there's a reduction of about a third by doubling the cost of cigarettes. I know some people don't like Bloomberg. They say, I don't know, I like Bloomberg, but Bloomberg increased the price of cigarettes a heck of a lot.
Sure.
Right?
Mm-hmm. All on taxes, based on tax.
And he increased the places where you could not smoke.
Mm-hmm.
So he made it harder to smoke.
Right.
And why was that? Why did he do that?
I assume it was for not only the person smoking, but the people around them, more importantly.
Right. So he wanted to save lives. I mean, basically he was there doing saving lives. So studies have shown that a reduction of a third of deaths could be achieved by doubling the price of cigarettes. And that's obviously done by taxation. Well, none of us like taxes. I don't like taxes either. The question is, what's the greatest good? And how do you get young people to stop smoking, something that's going to harm them terribly? Now, the risk is big. There's been large studies in England, United States, Japan, looking at mortality on populations of men and women who begin to smoke in early life and did not quit. The studies show that in middle life, and middle life is defined by 30 to 69, so you're still a youngster, I think, but I'm in middle life. Mortality among cigarette smokers was 2 to 3 times the mortality of other people who had never smoked. And there was a reduction in lifespan by 10 years.
Wow.
So smokers are taking 10 years of their life and tossing it in the garbage.
Yeah.
10 years of their life. It's shocking. And many of those killed are still in middle age, that 30 to 69. So they're losing many, 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 many years of life. On average, those killed in middle age by smoking lose about 20 years of life expectancy compared to those who didn't smoke. And stopping smoking works. That's the thing. If you stop smoking today, stop. It works. It will extend your life. If you're listening to this program and you're a smoker and you stop smoking today, this is a gift of years of life. Well, how many years? Well, if you're 30 years old and you stop smoking today, you're going to have 10 more years of life.
Wow, that's significant, yeah.
Shocking.
Shocking, yeah.
Right? If you're 40, you're going to have 9 more years of life. 9 more beautiful years of life if you stop smoking today and you're 40. If you're 50, 6 more years of life. So if you're listening to this program, this could be even a bigger gift than your Christmas gift. It's shocking. And obviously the people that started smoking earlier have higher mortality than those who started later. Cigarette smoking 100 years ago was relatively uncommon. The smoking is a relatively recent phenomenon. It occurred in high-income countries like the United States starting in the first half of the 20th century, the last mainly among men and then among women. In 1950, there were substantial numbers of men and of women who were smoking. And it took many years for the lung cancer rates to increase. You don't get lung cancer the day you start smoking, right?
Right.
It's years and years of smoking, and then it hits you. It hits you hard.
Yeah.
Right?
Sure.
So in the early part of the 1900s, people were smoking 1 cigarette a day or 4 cigarettes a day. So the rates of smoking were less, and it takes a long time to develop your cancer, sometimes not so long. And so in the early part of the 1900s, the death rates were not seen. But in the second half of the 1900s, people were smoking a lot more, and they had the years of incubation.
Mm-hmm.
So the harm was coming. It was coming down the pipe, and it hit hard. Now, 1 ton of tobacco produces 1 million cigarettes and about 1 death. So 1 trillion cigarettes a year causes about 1 million deaths a year.
Right.
1 trillion cigarettes cause 1 million deaths a year. So at the turn of the century, 1910, so 100 years ago, the average person who smoked only smoked 1 cigarette a day. Mm-hmm. So it's very different than today.
Yeah, sure.
By 1930, they were up to 4 cigarettes a day, and by 1950, they were up to 10 cigarettes a day, and now it's more. Tobacco caused, in 1950, 12% of all deaths. By 1990, in the United States, tobacco was causing 33% of all deaths in America.
Yeah. Unreal.
It's unbelievable,
yeah,
right?
Yeah.
So now this is happening in other countries. Low-income countries like China are taking up smoking at a very rapid rate. In China, almost no women smoke, so it's a very
more
social
of a male
thing.
skewed thing?
It's a male thing.
Yeah.
And I said before, in most societies, 50% of young men and 10% of young women will become heavy smokers. In China, it's less than that. It's a social thing.
Yeah.
So the whole point of this article is to stop smoking today, if you're a smoker. Stopping today will buy you years of life. It will be a beautiful gift, and you can do it. When you know the facts, you can do it. If you need help from your doctor, call your doctor. Come in. You can call us. Stop smoking today. The main thing is to get in your head that smoking is harmful, smoking is taking years of your life, smoking is destroying your health. If you've never smoked, don't start.
Don't see it.